Good evening, everyone. I'm Patrick Sanders, Executive Director of Development and Alumni Relations here at the Milken Institute School of Public Health. It is my pleasure to welcome all of you, alumni, students, faculty, staff, family, and friends, to our first ever virtual 950 Awards presentation and APHA Community Reception. This evening, you will hear from Dean Goldman with a brief State of the School address, followed by the fourth annual presentation of the 950 Awards to this year's 4 alumni awardees, Peter Fine, Clark Hagen, Chaya Merrill, and Allison Russo. Following the presentation of the awards, Dean Goldman will moderate a conversation with our awardees. I encourage you to use the chat function in Zoom to share words of congratulations and to submit questions for the alumni conversation. Following our alumni conversation, Dean Goldman will present the 2020 Outstanding Faculty Achievement Award to Professor Sara Rosenbaum. Following the presentation of this honor, Dean Goldman will engage Professor Rosenbaum in a conversation about her career and current events. Again, I encourage you to use the chat function in Zoom to share words of congratulations and to submit questions for their conversation. It is now my pleasure to turn things over to an exceptional public health leader and advocate, our very own Dean Lynn Goldman.
Thank you so much, Patrick, and good evening to all of you who've joined us this evening for this awards ceremony. While I miss seeing you all in person for our annual 950 Awards ceremony and annual community reception during APHA, I am grateful that we can come together as a community safely and virtually during this time. I am delighted to have so many alumni, faculty, staff, current students, family, and friends joining us this evening. There is no doubt that 2020 will be recorded as one of the most heartbreaking and challenging years the world has ever seen. A worldwide pandemic has claimed more than 1 million lives, and here in the United States, racial unrest and police brutality have claimed the lives of so many more. The pandemic has brought economic distress, as well as psychosocial stress, as people are physically distanced during this time of extreme unpredictability. Climate change and the increased numbers and intensity of tropical storms and fires, as well as heat waves, have threatened our health as well. And unfortunately, our actions to prevent COVID-19 have created other health hazards, as progress toward the development of cures has been slowed, and many have had less access to needed preventive and medical care. But it has also been a year where I have never been more proud of all of you in public health and healthcare management, all of you who are working tirelessly to help find solutions to these divisive and deadly problems. It is our public health and medical care community who have risen to the occasion and given us hope that we can all come together and find the solutions that will lead us to a safer and healthier world. The Milken Institute School of Public Health has long been committed to preparing society for pandemics and other public health crises. We are working globally to prevent and provide humanitarian assistance response to such crises. We are dedicated to the prevention of obesity and diabetes and building healthier food systems, all actions that make us more resilient to pandemics like COVID-19. We have accelerated our work in maternal and child health with a new Center of Excellence. We are building these strategies to prevent antibiotic resistance, cancer, and to cure HIV/AIDS. We are at the cutting edge of how racism affects health and actions that can be taken to build community resilience, to counteract adverse childhood experiences and adverse community environments. We have crafted policy analyses and approaches that bring people access to life-saving preventive medicine and cures. We are in the leading edge of understanding public health impacts of climate change. The faculty and students who are leading this research, community education, and policy analysis inspire me. I want to say a specific word to the students and emerging public health and healthcare professionals joining us tonight. We know this time has been especially challenging and disruptive for you. Investing in a public health education and training healthcare managers, even during normal semesters, requires incredible sacrifice of time, tuition. Perhaps you have put other life events on hold to study. Your courage in the midst of multiple interconnected pandemics is unparalleled. You are facing some of the most challenging, complex public health and healthcare delivery problems we have ever encountered. And you are not running away from those threats. You are running toward them to find solutions. I am so proud of you, and I am grateful for your partnership in the public health and healthcare community. Great public health and health management leaders have an enormous impact on population health, as we're about to hear from our award winners. I look forward to awarding our current students with a 950 award for your leadership and contributions to the field of public health in the years ahead. So now it is my pleasure to present our fourth annual 950 award recipients. This year, we're presenting our awards to four very deserving individuals: Peter Fine, Clark Hagen, Chaya Merrill, and Allison Russo. Why do we call it 950 Awards? In normal times, we would be enjoying this event in our state-of-the-art school located on 950 New Hampshire Avenue. Our LEED certified building has given us a remarkable home to educate our students and nurture the research of our faculty. This year, as the pandemic continues to require us to physically distance, work from home, and conduct classes online, most of us have seen a lot less of our beautiful academic home at 950 New Hampshire Avenue. But the importance of place and what we do there is not lost. How we, as public health and health management professionals, show up for our communities, our employees, our colleagues, students, and families is as monumental today as it has ever been, perhaps even more so. This is the very essence of the 950 Award. The 950 Awards honor alumni who display outstanding service both to the school and in their careers in public health, health policy, and health management. I'm going to present each award and then ask each awardee to make brief remarks. Following all four awards, we'll have a panel discussion with the award recipients. If you have a question for them or would like to offer congratulations, please use the chat. Our first awardee is Peter Fine. Peter was appointed president and CEO of Banner Health, based in Phoenix, Arizona, in November of 2000. Over the past 2 decades, he has definitely led one of the nation's largest secular nonprofit healthcare organizations, which employs more than 52,000 people. During the pandemic, Banner Health has been on the front lines of education, testing, and treatment for COVID-19 in Arizona. As hospital systems across the country face enormous challenges and pressures, Peter's leadership at Banner Health has never been more important nor more inspiring. In addition to his heavy leadership responsibilities, Peter is generous with his time toward the Masters of Healthcare Administration program and our MHA students. In 2012, he partnered with fellow alumnus Fred Brown to establish the Brown Fine Scholarship, which provides annual scholarship support to MHA students. In addition, he regularly speaks in classes, offers informational interviews, and hosts executive MHA immersions at Banner Health in Phoenix. I am pleased to present Peter Fine with the 950 Award.
Thank you, Dean Goldman. It's an honor to say the least. I never thought when I started at GW back in the mid-'70s, which was a most interesting time to be in Washington, D.C., without a question. And I came off of a year actually living in Aspen, learning how to ski. And I said, I'm leaving this to go to Washington, D.C., to go to school, and question my logic and my thinking. But actually, 43 years later, it was a very smart decision and a very smart move. The program at GW at that time was led by Dr. Leon Ginzik, just an incredible leader of a program at that point in time. And it was a large program, and it was a very worthwhile program. The clearest picture I have of that program was Dr. Robert Scholdice, and his efforts to educate us about new ways of providing healthcare and new ways of thinking. At that time, health maintenance organizations were starting. So it was a new learning experience. I advanced myself now 43 years later and have seen my career take all kinds of different turns until I got to Banner 20 years ago. Never thought I would stay more than 7 years. But have stayed obviously a lot longer because this industry was changing and Banner was on the forefront of the changes of this industry. So it became quite exciting and quite interesting intellectually to be able to take something that started out as a few hospitals and turn it into something that's very, very different today than it was when I first got there. Clearly, the lessons you learn in school only partly get you to where you need to get to. And one of the things you recognize that this business isn't a computer business, isn't a equipment business, it's actually a people business. And the skills of learning how to deal with people, how to work with people, how to collaborate with people, and those things come as you experience after school and your experiences that you develop after school. For me, my career has taken all kinds of different moves. And certainly one of the messages to students, if they're listening or hear about this afterwards, you have to take a very flexible approach to your career. One of the things that was clear for me as I went through the program is there are many different ways to use this degree and many different directions you can go into. I, for one, chose maybe a more traditional direction, but that direction took its turns along the way in which I would challenge myself with jobs that I, quite frankly, wasn't sure I was prepared for. But that put me in a position to learn. And learning is a lifelong thing. And to be successful in this industry, because of all the changes and the modifications that occur, you have to be in a lifelong learning process. You have to read, you have to listen, you have to talk, you have to engage, and you have to put yourself in a position of understanding the ebb and flow of an industry that is in the throes of being reinvented. I was highly interested in the Banner role because of the opportunity to be a participant in that changing industry and being able to look in different directions and create a company, quite frankly, that didn't exist like it did today, like it did 20 years ago. It's morphed and it's changed. It's followed the industry as it has morphed and changed as well. So it's been an exciting opportunity, and clearly for others getting into this, this is an industry that's going to be filled with jobs for decades and decades and decades. And people who are good leaders and can grab those opportunities. Sometimes young students get a little intimidated at taking on something that they feel they're not quite prepared for. But then how else do you learn if you don't do that? You have to put yourself out there. You have to take and look at opportunities that don't quite fit into the simple box that you created for yourself, and then run with it and be successful with it. I have had numerous jobs until I got this job at Banner 20 years ago. Now I'm older than probably everybody else on this screen, and I'm still doing it. So that says a couple of things. One, that it's still exciting. Two, it's still intellectually challenging. And three, I still have some degree of competency, and people want me to continue to stay in this role and continue to do what I do. So I thank you for the time. I thank you for the interest in me personally, and I absolutely cherish this award, and I thank you for it.
Thank you, and congratulations, Peter Fine. Our next award winner is Clark Hagen. Clark has spent a decade in federal service working for the Health Resources and Services Administration in the HIV/AIDS Bureau, and now leading the SINAR Underage Smoking Prevention Program for the Substance Abuse and Mental Health Services Administration. Clark is particularly invested in the student and alumni experience at the Milken Institute School of Public Health. During his time as a student, he was elected president of the Public Health Student Association. And as an alumnus, Clark became a founding member of our school's recent Alumni Advisory Council, which seeks to increase alumni engagement through networking, volunteering, and giving. Over the past 3 years, as part of the recent Alumni Advisory Council, public health alumni volunteerism has increased by 140%. To be honest, it's not a surprise for me to see Clark with us tonight because he is one of our alumni who attends APHA steadily and comes to our annual receptions and participates in helping to raise the awareness among all of our alumni of the school, for which I'm very appreciative. So I am pleased to present Clark Hagen with the 950 Award.
Thank you so much, Dean Goldman. This is a great honor, especially coming from you, who I regard with the highest of esteem. So I really want to talk about my time at GW and the incredible things that I learned there and I use every day. So coming to DC, I thought I might stay here for a few years, take a job or two, and then move on. But it's now 13 years later where I live with my wife, my son, and another son coming any day now. I, made lifelong friendships and work relationships. My best man at my wedding was somebody who I met in an epi class. I have learned so much that, my epidemiology training here, it's taught me the importance of data utilization. Good data props up every single good policy that we use. I've married my data and policy interests. I'm finishing up a doctorate in public health now and in health policy. And I realize the essential part that data plays in public health practice. The other huge thing that I learned at GW was networking. I was able to utilize a networking I made in Dr. Alan Greenberg's HIV organizational approaches course to meet the head of the HIV and AIDS Bureau at HRSA, who gave me my first federal job. And I was able to parlay that into the position I have now. So every time I talk to students, I encourage, send a message to somebody. We're all the GW family here. I think, the other thing to say is, working at SAMHSA, I'm working in the Center for Substance Abuse and Prevention, working on this youth tobacco role now. And the power of prevention is immense. With COVID, it's at the forefront of public health. We all realize how much prevention matters. Sometimes prevention seems to be a little bit underappreciated in this field, but, we talk a lot about treatment and, treating patients and our healthcare model is attending to that. But it's essential to talk about effective and economical interventions, which prevention. So I'll keep this short. Thank you again. Thank you, committee. This means so much to me, and I look forward to continuing to give back to GW, and thank you again for what this means to me.
Thank you, and congratulations to Clark Hagen. Our next award winner is Dr. Chaya Merrill. Chaya Merrill is director of the Child Health Data Lab within the Child Health Advocacy Institute. Through her work, she addresses health disparities that adversely impact Washington, D.C.'s most vulnerable children and their families, using community-engaged needs assessments, data-driven solutions, and transparency through community-facing data dashboards. As health disparities deepen and the effects of the pandemic weigh especially heavily on children and adolescents, I am especially grateful for Chaya's work. Her nominator wrote, Dr. Merrill's skills in cultural competence and respect for persons have strengthened community partnerships essential to addressing the mental and physical health needs of racial, ethnic, and socioeconomically diverse child populations in the DC area. In these ways, Dr. Merrell well embodies the spirit of GW. Chaya shares her skills with GW students by teaching in GW's annual clinical public health summits. Congratulations, Chaya. I am pleased to award you the 950 award.
Great. Well, thank you so much, Dean Goldman, and a special thank you to Doctors Katie Roche and Olga Costa-Priers for nominating me for this award, and the School of Public Health, the Milken Institute School of Public Health, for honoring me with this award. It means a ton to me. And I'd be remiss if I didn't acknowledge the incredible faculty and staff at GW, from iconic professors like Professor Rosenbaum, who I had the privilege of studying under while I was at GW, to really help me understand how to merge my passion for everything that I believe in with the science of how to make this happen. You know, at my time at GW, I learned quite a bit. I learned how to critically assess really complicated societal issues. I learned the power of data and evidence in terms of how it has to inform everything we do. I learned how empowering communities is the key to everything, and really to learn empathy as well. So I learned a ton in that time, and I thank everyone for this opportunity. I feel like in this special time right now with COVID, I mean, we're in a global pandemic. We also have a very heightened awareness of racial injustices right now, a much needed heightened awareness. I am extremely confident that I picked the right field of study to make an impact. And all of this led me to what I would say is my dream job. I work every day at Children's National Hospital as part of the Advocacy Institute. And given all the skills I gained at GW, the relationships and the networks I made, I know that I have the ability to make a difference in the lives of children who live in our community. And for that, I will be forever grateful. So thank you very much for this incredible award and the honor.
Thank you so much, Chaya. And my apologies. I knew that, and I said Chaya, and I apologize for that. It is wonderful to hear about your work. Our final 950 award of the evening goes to Dr. Allison Russo. Allison has spent nearly 2 decades advising government leaders and policymakers on issues related to healthcare and healthcare delivery, especially as it relates to seniors, women, veterans, and military families. Last year, Allison made the jump from advising government leaders to becoming one and was elected to her first term in the Ohio State House of Representatives. Allison is committed to improving the health and well-being of Ohio's children and families, co-chairing the Bipartisan Legislative Children's Caucus and serving on the Bipartisan Mental Health Caucus. She brings a practical approach and evidence-based solutions to the critical issues facing Ohio, introducing several pieces of important legislation that address healthcare access, the protection of public health and safety, and the financial security of family caregivers and aging adults. Dr. Russo demonstrates the impact of bringing public health to the policy table to shape systems that promote health and well-being across the population. I am pleased to award Allison Russo with the 950 award.
Well, thank you so much, Dean Goldman, for this award. I'm truly humbled to have received it this year. It was completely unexpected. So I would like to say a thank you as well to Dr. Ann Marcus, who made the nomination for this, as well as some of my former advisors in this program, Dr. Marcus, Dr. Susan Wood, who was actually chaired my dissertation committee, and our own Professor Sara Rosenbaum, who I know is also being honored tonight, who was chair of the Health Policy Department when I was at GW. I always say that my training in public health, and particularly in health policy, really prepared me perfectly for a very unexpected transition to elected office. I use that training every single day in both the legislation that I consider and the issues that I hear from my constituents and across the state of Ohio. And nothing prepared me better than looking at these issues holistically than the training that I had at GW and in the School of Public Health. I am so honored and proud to have gone through this program. I had many wonderful classmates, one of whom is being honored tonight, Dr. Chaya Merrill, and many wonderful professors and instructors who I encounter all the time in this field. And it brings an enormous amount of pride to know that I came out of such a high quality, high caliber training that, again, made me really just in a perfect position, particularly at this point in our history of this country, where we are facing this once in a lifetime pandemic, where we also are facing racial injustice, and we're understanding how those things work together, and how they have really laid bare problems that we've known have been in existence for well before these pandemics or this pandemic. So again, thank you so much for this honor, and I'm just very humbled to be receiving it.
Thanks to you, Allison. Now let's bring back all of the 950 awardees for a conversation. If you have questions for the awardees, please put them in the chat window, which is being monitored by our staff. We'll try to get to as many of the questions as possible in the time that we have. So I'm going to start out with a question for all of you. What has it meant for you to be in the public health profession this year? Has it felt different? If so, how are you managing that change? Don't all go at once.
So I'll start. I mean, I certainly, well, first of all, I never planned to be in elected office. But certainly never planned to be in elected office during the middle of a pandemic. Before I came to GW, my master's degree was in epidemiology. And, the things that I have been able to reference that knowledge base and really becoming a source of, I think, trusted information amongst some of my colleagues as well in this space, and really being able to talk from a very science-informed perspective, which is often difficult when we are in the policymaking and in the politics. Really, a lot of politics around this pandemic has been extremely helpful. And I think for the people that I serve, I've been able to be a trusted voice for information and deciphering some of the data and what we're seeing. So in that way, I think it's been incredibly helpful for me.
And I'll just go ahead and echo what Dr. Russo said. I think both of us went through an epidemiology program, and I think it's really served us well when there's just so much confusion and misinformation out there that we're able to look at the information critically, help our community partners, parents understand and make sense of all of this very confusing information in this very scary and troubling time. So this degree at this time could not have been a better fit. I'll also say that, I don't think anybody on this call at this event is probably surprised by the inequities in healthcare outcomes faced by communities of color that are experiencing these really dramatic COVID cases and rates. I don't think any of us are surprised, but given the training that all of us have on this call and gone through this program, I think we're really able to make those connections for people and really refocus the attention on racial equity issues that we've all been fighting for decades, many of us. But it's fallen out of the public's eye. And I think COVID has somewhat brought that back to attention. And I really thank our public health training, and very specifically our EPI training, to be able to have those difficult conversations with people and hopefully incite some change.
I'd like to jump in and talk a little bit about the logistics that, we've all, been out of our offices and out of our comfort zones in this pandemic. And I think it's kind of allowed a avenue to reach out more, picking up the phone or sending emails to folks and really networking nationwide and worldwide and working on these issues with a team of cohorts that understand where you're coming from and share that knowledge base with you. Obviously, terrible news happens every day in the past few months, but being able to work with each other on this across large distances, I think is going to change the way we do business for years to come.
And Peter, did you want to add?
Sure, I was going to. I would tell you that never can I remember a time in my career where the collaboration and the communication with our public health officials has ever been as critical as we have now. I mean, just this morning, I spent an hour on the phone with our governor and the head of our public health department, Dr. Kara Christ, and we were talking about what are we going to do to handle this next wave. Arizona got hit bad in June and July, and now it's coming back again. And how are we going to handle this? And this collaboration was so critical because you have to marry up the front lines with the people not on the front lines who are trying to help us think through how to problem solve the issues that we're faced with. So it's been a very important aspect of what we deal with now. And somebody mentioned a minute ago about this whole issue of communication and confusion and lack of understanding. And that's where the credibility of our public health officials really has to come into focus right now, because without that, we're just running blind.
That kind of actually moves me to a next issue that I thought it would be interesting to hear you all talk about, which is that one thing that I've noticed in recent years that many of our students are aspiring to be leaders in one form or fashion. And all of you are leaders in different ways. What would you have to say to our students about what that means? What does it mean to you to be a leader? And do you have advice for students who are interested in eventually being leaders in public health and healthcare management?
Well, I'll jump in there if that's okay. Been doing this for a long time, and there are little tidbits that you pick up along the way. And certainly, I would say your ability to be authentic and be vulnerable. People respect authenticity, and authenticity requires vulnerability. And you have to recognize that to sell your ideas, you have to be credible. And so the other thing that I say often to all of our young leaders in the organization is visibility breeds credibility. Credibility breeds trust. If you want to be trusted, you better be visible. There is a tendency in this world of electronics, quite frankly, to hide behind a screen, to sit in an office and crank out your spreadsheets, and to forget that you're really in a people business. And leadership requires the recognition that you are dealing with people, and you have to learn how to interact with them, and you have to learn how to motivate them, and you have to learn how to encourage them.
Yeah, I'll add that. I'll add on to that. Relationship building is so to effective leadership. My team is comprised of very diverse team, all ethnicities, all ages, all political affiliations, and putting that aside to focus on the mission at hand is essential. When people can come to you with a substantive question and expect that you'll have the right answer, and come to you with any of the questions that they have about really any type of thing. And I've had people come to me with some kind of out there things, and just being able to have that trust to help somebody out, to have that strong relationship, and at the end of the day, to focus on the mission at hand.
So I'll jump in. Those are all wonderful points to make. I would say that the two things that I would add, particularly from my perspective in the policy making side, is listening. It's probably one of the most valuable leadership skills that I use in my job every day. And I think, again, this is where I go back to my public health training. One of the beautiful things about public health is you're really operating in a multidisciplinary field. And so listening to different perspectives is incredibly valuable. And it's something that I've been able to build on, certainly in the job that I'm in now. And then I would also say it requires courage in being a leader, and sometimes making really incredibly difficult decisions, and standing in your decisions when you make them. So those are the two things that I would add is, again, being working on that listening piece, and then also knowing when it's valuable to have courage.
These are all such remarkable comments. If I were to add something, I would say that it's really, really critical, whether it's leadership or just the daily work that you do, to place your passion at the center of all of it. Figure out what drives you, and you will be contagious. I had a mentor tell me something once that really changed how I think about leadership and my role in the workforce in general. And this was maybe 5-6 years ago. I was talking about going back to school, maybe getting another degree. There are so many things that I'm interested in. And he pulled me aside and he said, learning is lifelong. You will always learn. You can go get degrees. And at some point, you will transition to become a little bit more of the teacher than the learner. So make sure to pass it on. And I've really taken that advice. I think leadership, there's so many aspects of it. One thing that we can all actively do is make sure to pass on our learnings and to people. So for example, at the hospital, I work with a lot of our residents and our fellows to make sure that they are learning from me, and I'm paying it forward as well.
Thank you for that. I have a question specifically directed at Allison, but some of the rest of you may have responses to it as well. And that has to do with your role as an elected official, and how critical is it that we have elected officials who have a public health background. And I'm also interested in actually what inspired you to run for office in the first place. Having been around politics as much as you had been, you had to know how difficult that world is, really. But
well, that's a great question. And, in terms of how important it is to have people with public health training and backgrounds in elected office, I would say it's critically important. I think all of us know, when we think about all of the things that impact the health and wellness of individuals and of population, so much of it is based on good policy that really has nothing to do with health. Things like secure housing and economic security and the quality of education and how do we eliminate systemic racism. Those are things that, from a policymaking perspective, you have to be very focused on. And I am very focused on healthcare, certainly in my job and the committees and the legislation that I'm drawn to. But I also recognize and am able to, again, put together that whole picture of understanding all the various facets that impact an individual and population's healthcare. Interestingly enough, in the Ohio General Assembly, there are 3 of us that come with public health training and backgrounds. I'm the only one who came out of this program, but that has certainly been very interesting, especially in the last couple of years. And in terms of, what made me make that transition, I think it was, for me, 2016 certainly gave it to me like it did many people across the country. But specifically, it was, again, knowing all of those things that impact population health and an individual's health that, I simply could not change from the role that I was in as an advisor, that I really had to be on the other side and recognizing that we needed more people in elected office who came with some not only great life experience, but also expertise to make these evidence-informed decisions about policy. And there just wasn't simply enough of that. And so that was really what motivated me to finally run for office.
it's interesting, and I think many of our current students as well as recent alumni are very interested in trying to address some of those determinants of health that you listed, the social determinants, so-called, that, I mean, it all kind of ends up being a little bit obscure. The way that you brought the issues forward, I think, was very illuminating. But what would you advise our students and recent graduates in terms of, if they want to get involved with addressing those kinds of issues, what are some avenues that are available for them for doing that? I'm looking particularly at Chaya, who I know that you've given this a lot of thought in terms of the way that you practice public health. We don't hear you. I can lip read you, but I can't hear you. Chaya, I'm going to go ahead and ask a different question, and then perhaps we can come back around to you in the discussion. Perhaps turning to Peter Fine, I'm trying to picture this image of you're skiing downhill somewhere and just having a great time. And then the thought comes in your mind, idea, I'm going to be a healthcare administrator. I don't actually believe that that's how it happened. How did you actually become inspired to pursue the career that you are pursuing?
So my mother was an office manager for a general internist for 20 years. And as I was debating what to do with the rest of my life, she said, "You ought to go into hospital administration." I said, "Why would I want to do that?" She said, "Well, you like business. You've been reading Fortune magazine since you were 10, and you like the idea of doing something to benefit others." She goes, "That's a good option. That's a good marriage of using business skills and having an emotional attachment to a business and an industry." So I got very interested in it at that time. And somebody I met in Aspen at the time had been a hospital administrator in the armed forces before he went into law, and actually was at the time Nixon's private attorney during that very difficult time of the mid-70s, and was a graduate of GW. And so he encouraged me to do that, talked to me a lot about it during the winter I was out there. And it just became very interesting to me as a career that could meld two interests of wanting to do good and having this sense of, I want to run a business. I want to be interested in a business. And it became a perfect marriage for me.
That's very interesting. And I wish my daughter had been listening, because the moral of the story, listen to your mother. That would have been good for her to hear. But Chaya, are you back with us? No, you're not. Not yet. No. Okay. I'm wondering, Clark, if you had a response to that issue of, what inspired you to even think about epidemiology, health policy?
So sure. I had always been interested in healthcare. I thought about going to med school. Really liked the patient relationship. However, as I started, I worked in some direct clinical services for a few years after college, and I really thought that I could do some greater good at the population level. And that's what really drew me to epidemiology is the study of populations, where, helping to provide data that can create policies that doesn't just impact one person, but can impact, nations, the global economy, the global healthcare system. And really speaking to people in that field really got me excited, and got me excited about the potential for doing some good in a positive way, and kind of taking the 10,000 foot view of things. You don't always get to see the impact you have on folks, but you know that the processes that you've put in place have really helped people.
I think that's a really good point. I went through a similar experience when I was younger, realizing that as a physician, I could patch people up and send them right back into the same conditions that were making them sick in the first place.
Sure.
Or I could try to swim upstream and identify the factors that were causing them to become ill. And even though it is hard to see the direct impact, it feels really good to be addressing those upstream factors.
Sure.
Peter, hi. Yes.
Yeah, I'm going to make a comment about the question you were talking about earlier that we couldn't hear from Chaya, and about the social determinants of health. You know, one of the best places to really get a feel for that, and certainly if you want to be on the front lines of that, are federally qualified community health centers. We work with a couple very closely. One's very, very closely in Colorado, called Sunrise Health, which is in 2 communities that we have hospitals in. We're in 6 different states as a company, and Colorado being one of them. But every day they are fighting the battle of social determinants of health in trying to provide services to the population that they have to provide. And it's you see it and you feel it every day in how they do their work and how they have to interact with the issues of social determinants of health in order to provide the kind of service that they have to provide to their clientele, which are always underserved clienteles, certainly most of them uninsured clienteles. But if you look at all the notoriety sometimes in this country is around big boxes and big hospitals and clinics and things like that, I got to tell you, go out to the front lines of a community health center and you'll see what the real world really looks like. And it's something that I've argued with HHS numerous times, that if you really deal with the problems of social determinants of health, you need to create more funding for federally qualified community health centers, because they really do a fantastic job.
I mean, I would say I have visited Peter in Phoenix, and he's not exaggerating when he says big box. So I'm very impressed by the fact that somebody like you, who leads such a large health system, is so much in touch with what's going on in those community health clinics. I saw a lot of nods from the other award recipients. I think we're all, one way or another, aware of, not only aware of, but have somehow those clinics have touched our careers. They're so important. And so thank you for saying that. I also very much appreciate what your organization does. I can't even imagine what the experience must have been like last summer when you had not only that surge of COVID cases, but also record-setting 100-degree heat, probably people with heat strokes showing up, and being able to manage being at nearly 100% day after day after day. People don't realize the extent to which it's not just first responders, it's not just the emergency room doctors and nurses, but it's also people like you who keep the system running and figure out how to get that PPE and how to get beds, make beds available for people when they really need them. And I'm sure you had many days with very little sleep, lots of worry. It's an immense job, and we appreciate it, Peter. I just wanted to say that.
Throughout the last 6 months, our system, if I pick on Arizona, we have handled 45% of all the COVID cases in the state. Quite a bit more than our market share in the state. But we have a lot of high-end places that can take those referrals. And it has been a very difficult process. But the one, as I mentioned to the governor on the phone this morning, when they talk about an increase in do we have enough beds, I said, you're missing the point. Beds aren't the issue. Beds are easy. But burnt out staff, that's not so easy. No. We've had people go home crying at night because of what they had to deal with in the height of the pandemic in June and July. And it gets to the same issue that no matter what it is a people business. And you have to recognize that you have to deal with those issues if you want them to come back to work the next day. But I have been, in my 43 years, never did I, in this industry, did I ever think I was going to be at the tail end of my career dealing with a pandemic. But the pride that I have for how people have responded selflessly to respond and come into work day after day wearing a mask. When I hear people whine on the street about having to wear a mask to go to a restaurant, are you kidding me? I have staff that wears those things 12 hours a day without any relief, and they're doing it to take care of the public. So our staff isn't very happy when they see the public not wanting to respond to mitigation activities that really aren't very tough to deal with, but are necessary to deal with to protect the public at large and actually protect our caregivers as well.
Yeah, because by the way, the elastic on that N95 mask is pretty tight. So, but thank you so much for that. And speaking of people, I do want to thank, as we're concluding this brilliant discussion, Patrick Sanders, who is with our university, has been monitoring the chat box and providing me and us all with assistance here. And it's pointed out actually that from the people watching this, we've had many reports that of pride from our community, congratulatory messages to all of you. I wish you could hear them all. I wish that we could bring you all together with those people. But I did want to give you, once again, my personal congratulations, as well as the news that there are many who are watching who are sharing their congratulations. Thank you all. And I'm going to move forward to our 4th annual Outstanding Faculty Achievement Award. It is actually no secret that I am a personal fan of this faculty member whom I'm going to award this Outstanding Faculty Achievement Award. All of our faculty, I would say, are incredible teachers. They are skilled practitioners and remarkable researchers who are at the forefront of cutting-edge research in various areas of public health and policy. But I'm especially thrilled to present our 2019 Outstanding Faculty Achievement Award to Professor Sara Rosenbaum. This has been a really big week for Sara in terms of awards. Just 1 week ago today, she was honored with the Adam Yarmolinsky Medal from the National Academies of Medicine for her outstanding scholarship in health law and public health. So you have to understand, she's the outstanding among the outstanding, but it's so well deserved. Congratulations, Sara. Sara has shaped our school and our students in countless ways. She is the founding chair of the Department of Health Policy at the Milken Institute School of Public Health, a department which not only grew remarkably over the last decade, but combined with our health management program to become our Department of Health Policy and Management. She has graduated numerous truly excellent professionals, some of whom we've just honored with 950 awards. So we asked some of Sara's former students to share the impact she has had on their lives and careers. How do students describe Sara? She's a trailblazer. She demonstrates how change is possible if you have expertise, creativity, and yes, tenacity. Run, don't walk, to take Professor Rosenbaum's health policy classes, one student said. Another wrote, taking the health services law class with you, Sara, this spring before COVID was one of the highlights of my year. I always valued your time, insights, and way of teaching complex law and policy topics so effortlessly. Sara pioneered the application of civil rights law to health policy in her work on national health reform, Medicaid and private insurance, Medicaid managed care, healthcare access for medically underserved communities and populations. She also has been incredibly important to the health and health care of children in helping to create the EPSDT Medicaid program, the Vaccine for Children's program, and many other efforts that she undertook. She's been important to the health of women in her tireless efforts to try to secure and ensure funding for contraception and other women's health care. She has modeled public engagement as a core element of her professional life, providing public service to 6 presidential administrations and 19 Congresses. We've asked Dr. Fagala Jacobs, President and CEO of the RCHN Community Health Foundation, to honor Sara with a few words.
Dean Goldman, thank you so much. Good evening, everyone. It's really my honor to be here with GW faculty, students, alumni, family, and friends to recognize Sara. I was, thinking as you were reading some of the comments from Sara's students, I had some wonderful professors myself in public health school, but I didn't have Sara, and I feel like I missed out. I want to talk for just a moment, though, about what I view as one of Sara's signature contributions to the school, because I think it'll help convey some more about her and why Sara's been so central not only to the law school, not only to the Milken Institute School of Public Health, but to the greater community and to the community health center world where I do most of my work. And that's her role in creating the Geiger-Gibson program in health policy. This is a program that was named in tribute to Dr. Jack Geiger and the late Dr. Count Gibson, two physicians who were dedicated to civil rights and healthcare justice and who became the founding fathers of the community health center movement in the United States. Sara initiated the Geiger-Gibson program in 2004, I believe with the intent that it would really be the academic counterpart to the health center program, dedicated very much to advancing health equity and to eliminating medical underservice, just as the health center program itself does. And she did this, I think, with a little bit of pocket change that she had squirreled away, and a lot of tenacity and a great measure of goodwill that helped garner some early modest contributions from health centers and other organizations. About a year or so after she founded the program, we founded my organization, the RCHN Community Health Foundation. And one of the things that we knew when we were starting the foundation is that we wanted part of our work to include an academic partnership. And that was because we saw the need for an evidence base for policy and service delivery focused on community health centers and the safety net. And so the Geiger-Gibson program was a natural fit. And that's when I really came to know Sara and how we came to collaborate to form what's called the Geiger-Gibson RCHN Community Health Foundation Research Collaborative, with its academic home based here at the school. The scope and depth of this collaboration is very extensive. And now in its 15th year, what we have is really a testament to Sara's vision. This program provides opportunities not just for policy analysis and research, but for in-depth training for the university's own students in the School of Public Health, the law school, in public policy, but also for the broader community of health center colleagues who participate through seminars and policy fellowships. And I should say here that the Policy Fellowship Program has long been a wonderful residential program. It's intended as a kind of cohort-based opportunity for our practice colleagues to come from community health centers and primary care associations all over the country and spend a few days in Washington, D.C., learning from experts at the university and on the Hill. And for the first time last week, this program was conducted virtually with great success, thanks to Sara and her team in the department. So we had to adapt and adjust, and we did. And the collaboration that we've developed with Sara and the Geiger-Gibson program itself, I think, has had an extraordinary impact. And I think that that's quite simply because Sara was behind it. Of course, she's got singular talents, which you talked about, Dean Goldman, and singular skills. She's a superb writer and drafter. She's an exceptional teacher. She's a tireless advocate. But what makes her work exceptional is that it really reflects her values and her sincerity and her deep humanity and care for everyone around her, not only for her immediate colleagues and her friends and family, but also for the broader community that we're privileged to be a part of. She really modeled what it means to be an educator advocate. Patrick Sanders asked me to talk about when I first met Sara. I can't actually remember when I first met Sara. I feel like I've always known her. But I do know that every day for the past 15 years, I've just been continually awed and inspired by Sara. And just as she's left her mark on generations of students at the university, so too has she left an enormous impact on the health center community and our foundation itself. And I think it's fair to say that the success of my own organization is due in great measure to Sara's collaboration, to her insight, to her guidance, and to her mentorship. So it's really a remarkable, lasting imprint that she's made. Sara's my revered colleague and my dear friend, and I can really think of no one more deserving of this recognition. So thank you for inviting me to share this moment with you.
And thanks to you, Fagala, for your support to Sara Rosenbaum and for your comments. Let's now hear from the 2019 Outstanding Faculty Achievement Award recipient, Professor Sara Rosenbaum.
Well, you know, I hesitate to say anything at all because I'm so overwhelmed. It was certainly wonderful and lovely to win the Yarmolinsky Award last week from the National Academy of Medicine, but it quite frankly doesn't hold a candle from this recognition from Dean Goldman, from Dr. Jacobs, who among her many accomplishments ran a foundation and got a PhD in her spare time, and has been like Dean Goldman, just a tremendous friend and colleague. I have so many colleagues at GW. I really think of GW as my family. I mourn every day that I come into the office, the days of the week that I come into the office and my family is not there. And of course, our wonderful alumni and students and the amazing recipients of tonight's 950 awards. I cannot tell you how proud I am looking at awardees and realizing that, you know, they were my students and just being in awe of what they have accomplished in their lives. And one of the great joys of working in Washington, D.C., and teaching in Washington and doing health policy work in Washington is that there's almost no place I can go. Of course, now we don't go anywhere. We just go places virtually. But there's almost no place I could go up until March 13th, 2020, where I didn't see my former students. They were everywhere. They were in congressional offices. They were in federal agencies. They were in national organizations. They came back and guest lectured in my classes. They're still doing that. That's easy enough to do on Zoom. I am surrounded by the best evidence anybody could ever ask for of having had a successful career. I came to GW about 30 years ago. I had already been in practice for about 15 years by then. And yes, Fagel and I were both tots at that point. I had not done anything to prepare for a career as a professor. I had been teaching actually at both Hopkins and Georgetown. And one day out of the blue, I got a phone call from a longtime friend and colleague who at that point was establishing a budding health policy research center. And he said, "You have to come here." And I had sort of been thinking about making a change. I had had an extraordinary career with Marion Edelman at the Children's Defense Fund, but I felt that I was ready for a change. Ultimately, I joined as a research scientist. I didn't join as a faculty member, really, although I moved into faculty status and was very fortunate to become one of what grew into the founding faculty of what became the School of Public Health under the extraordinary, vision of Dr. Richard Riegelman, who sort of imagined a school and wrote whole blueprint for the school on yellow stickies. If you know Dick Riegelman, you know that everything in his life was written on yellow stickies. And we flourished. We flourished under Dr. Richard Southby, who became the dean after Dr. Riegelman. And I was fortunate enough to be on the search committee that led to the arrival of Dean Goldman, who is really, beyond extraordinary as a dean and as a leader of this school. It's very hard to convey to people, even people who know the school, all the alumni, all of our colleagues, everybody, the fortitude and brilliance that it has taken to build this school into what it is today. And the best thing about Dean Goldman is that, like so many of us at the school, she has always valued public engagement as just a core part of who she is. And so she's a leading academic figure and researcher, but also a remarkably engaged person. When I had the idea a few years ago that what the deans and scholars at schools of public health everywhere needed to do was to be able to speak to the courts during this administration through a series of amicus briefs. I sent an email to the dean and I said, I want to start working on amicus briefs. And she was the first signatory on all the briefs. I mean, it was, and rounded up all the other deans. So, this is somebody who has never broken between the life in academia and life in the world. And the thing that has made being at the school so valuable is that the dean is our dean, but she shares this feature of herself with everybody at the school. It's a remarkable school of practicing scholars. I thought long and hard about, did I want to be in a law school? Did I want to be in a school of public health? And once I found the School of Public Health, I knew this is where I wanted to spend my life in academics. I didn't go searching for it, but I am very grateful that it found me. There are so many things I valued over the course of my career, but really the students and student engagement above all. I only hope that I have given them half as much as they've given me. And above all, I'm really grateful for having been part of the world of connecting students to public health. And along the way, I think one of the greatest lessons we at our school have imparted, because we're so eclectic, is that public health really belongs to no single discipline, but it really represents a collective endeavor that rests on an embrace of solidarity in the pursuit of equality and justice. So thank you so much for this award, and I am really honored.
Oh, congratulations again, Sara. So we're now going to do some Q&A with Sara, and we still have the chat window open. If you have questions for Professor Rosenbaum, please put them in the chat, which is being monitored by our staff, and we'll try to get to as many questions as we possibly can. But I'm going to start with one. And Sara, how did Medicaid and the CHIP programs become your passion? How did that actually come about for you?
That's a very good question. Well, I started off as a legal. Actually, I started off way long ago as a public defender, and decided that I liked civil law better. So I became an early legal services attorney after the Legal Services Corporation was established. And I fell into Medicaid and Medicare actually in the early part of my career. It was totally a fluke. And basically, this was within the first 10 years of Medicare and Medicaid's establishment. And virtually every case that walked into my office was somebody who needed money or somebody who needed health care. I was fortunate because my practice began in Vermont, which I must say was a very benign place. The very forbidding winters, very tough place in climatically to be poor, but it was a gentle state. Although legal services lawyers, where our average age was 25, of course, only knew how to sue everybody. And so I cut my teeth bringing Medicaid and Medicare litigation, and was very lucky to be noticed by the National Health Law Program, which exists to this day. It's a national support center for legal services, and they recruited me to become one of their 2 Medicaid lawyers. And so all of a sudden, my job, along with that of a colleague, was to essentially flesh out the Medicaid program for community legal services. And I was extremely lucky because our practice was national in scope. And I had to flesh out the meaning of Medicaid, not just in benign places like Vermont, but in very forbidding places like Texas, where, by the way, I discovered this thing called community health centers by flipping through the old catalog of federal domestic programs, and decided this was the answer to all of our woes, that you'd have insurance and you'd have a community health center, and did that work. And then one day got a call from a place called the Children's Defense Fund that they were working on what was then this little itty bitty thing that Secretary Califano, under President Carter, could never get right. He kept calling it CHAPS. It was CHAP. And it was the early effort to expand Medicaid to poor children. And from there, the rest was history. I went to the Children's Defense Fund, and we embarked on a 15-year effort to transform Medicaid for low-income children. And that, of course, eventually led to the addition of the Children's Health Insurance Program that expanded the reach. So, the kind of big changes we saw in the Affordable Care Act in one fell swoop, Medicaid for adults, we did. And of course, when I first met Dean Goldman was around child health and Medicaid through the American Academy of Pediatrics. And it was this very long slog to build the program. So it was nothing was planned. It just kind of was organic.
Yeah, I think we may have made you an honorary pediatrician at some point, Sarah, but if we didn't, we should have. But I'm going to ask you a question that I'm often asked. It used to be just by women, but young men also ask me this question a lot too, which is how you find the balance in your life. You are an incredible advocate. You are an educator. You are a scholar. I know that you're going to have a paper in the Journal of the American Medical Association tomorrow, something that would be envied by almost anybody in our field. And then you're also a wife and mother. You have a family. I know that I
grandma.
Talked to you about your own mother. Yes, all of that. And how do you do all of that? And how do you decide on any day what you're going to do? I mean, is it going to be the Supreme Court brief or JAMA or your daughter?
That's a good question. I don't really know. I mean, there's a little magic to it. You sort of get up in the morning and you start going, and you are very efficient in your use of time. I think part of it is really that there's nothing that I do that I don't love. I can't imagine not teaching. I can't imagine not working on something quite real that's happening in the world. I can't imagine not writing and thinking. And you end up sort of always biting off more than you can chew. I'm sure, like you, that feeling of feeling a little frantic or fagula that you've now really done it. You're way beyond where you should be in terms of commitments. I have a wonderful husband who has been my rock through everything and is so supportive. My daughter, if anything, is more committed to her career and being a mommy and being all those things at the same time. And I think I'm just one of those people who sort of likes drinking out of a fire hose. And I've also been so fortunate. Fagel mentioned the Geiger-Gibson program. The Geiger-Gibson program has a whole bunch of us in it. My research work has a whole bunch of us in it, and of course, I have 50 colleagues at GW. I could pick up the phone to any one of them and say, you want to do X? You want to work on Y? And they say, oh, yeah. So it's also being surrounded by people who are, who like to do stuff.
Well, one might say it isn't random that you're surrounded by those people, Sara. One might say that you have a special skill of gathering people together to do important work. Myself having been one of those, and you had a nice way of saying that, but so many people who have been just thrilled to be able to work with you and to be able to carry forth the brilliant ideas that you have brought to our field. One thing that I'm also curious about is, it's unusual to have somebody who is so dedicated to the law and health law at a school of public health. There are few around the country. You could have been at a law school. You could have been at a school of public policy. What has that been for you to have been at a public health school in terms of your ability to pursue your career in the way that you've done?
It's a very interesting question because I would say, well, I guess I would answer in a couple of ways. Number one, it took me a little bit of time, but less than I might have thought to suddenly realize that I was in the middle of the people who actually could produce the empirical evidence that lawyers need. I mean, this was like, oh, look at this. People who, whether it's Ann Marcus or Leighton Koo or Jeff Levy or somebody like Alan Greenberg in EPI, all of the people who do phenomenal empirical research, and you think, this is evidence. This is what lawyers lust after. And if they sort of can see the translational role that law plays, that we are the people who help organize evidence into policymaking forums, and that much of those policymaking forums speak the language of law. So I can be kind of a Sacagawea for people who produce evidence by figuring out with them how you take that evidence and turn it into a court decision, turn it into a statute on the books. The Medicaid expansions for children are case in point. They exist because suddenly it became evident to policymakers what it meant for children not to have insurance. Cases have been won in the Supreme Court. I don't know how we'll do from here on in now, but judges, something happens when people become judges, and particularly when they become judges in the highest court in the land. And it's a sobering experience in terms of having to step back and think long and hard about evidence. And one of the things I feel best about over the past couple of years is the work that our school has done organizing and presenting evidence to courts. And I've seen now on several occasions when our briefs have been cited because of the evidence that was presented. So I think it was not wanting to be with a whole bunch of people like myself. I didn't want to sit around talking legal doctrine. I wanted to practice health. I wanted to be with people who were all about applying what they learned, and that's that is public health to me. It's so much more alive than a purely legal environment.
Thank you so much, Sara, and congratulations. I want to again congratulate our 5 2020 950 award winners this evening. If you haven't already, I encourage you to share your congratulatory messages in the chat. I thank you all for joining us tonight and for everything you do to make the Milken Institute School of Public Health successful. Without the brilliance and dedication of our faculty, staff, students, donors, and alumni, we wouldn't be able to lead in public health in the way that we have been able to this year. I mentioned earlier that Patrick Sanders has been backing us up tonight, but also Sarah Hoffman-Graham. I owe you a huge thanks for being able to put this program together and providing support to us to be able to continue our operations during a time when it's been so difficult for us all to get together. But I'm now going to turn the program back over to Patrick Sanders to close out our evening.
Thank you all so much for joining us tonight. I echo Dean Goldman in congratulations to all 5 of this evening's awardees. I hope tonight's program has inspired you, as it has me, to continue to engage with and support this incredible community. My team has shared links to upcoming GWSPH events in the chat. You didn't catch them, no worries. We'll include them in a follow-up email. Indeed, we had so many wonderful questions from all of you this evening that we'll certainly schedule some follow-up conversations with our awardees soon, especially with Dr. Merrell, who we're very sorry we lost our audio connection with. As Dean Goldman shared in her opening remarks, we are so proud of our students studying public health with us here at GW so they may help improve the health and wellness of communities across the United States and around the world. These students will one day be the alumni who we have the pleasure of honoring with the 950 Award. With your support to our scholarship fund, you can help to ensure they are well supported during their studies and that they graduate positioned to pursue their dream careers. Please visit the link on your screen, go.gwu.edu/support SPH students to make a gift to our scholarship fund. And if the link isn't showing up, it'll show up in the chat momentarily. Congratulations again to all of our awardees. We wish everyone joining us a wonderful evening and continued good health. Good night.